Hello, I'm Dr. Edward Ye, Chairman of the Department of Cardiology at the University of Texas MD Anderson Cancer Center. I would like to introduce you to a lecture series, the MD Anderson Practice of Oncocardiology. In this lecture series, faculty from the Department of Cardiology will discuss important topics that are relevant to the care of cancer patients with heart diseases. I hope you would enjoy this lecture series and embark on a learning journey with us.
Hello, I am Anasita Fadol, Assistant Professor in the Department of Nursing with a joint appointment in the Department of Cardiology at the University of Texas MD Anderson Cancer Center. I completed my Doctor of Philosophy at Texas Women's University, and I joined the MD Anderson Cancer Center in 2001. I'm a board-certified family nurse practitioner. My clinical and research interests are in the cardiac complications of cancer therapy, specifically on symptom management in patients with cancer and concurrent heart failure. I developed and implemented the HeartSuccess program, a collaborative, interdisciplinary program for the management of patients with cancer and heart failure at MD Anderson Cancer Center. I am going to talk to you about the long-term follow-up of patients with chemotherapy-induced cardiomyopathy and heart failure.
Today, I'm going to discuss the process that we use at MD Anderson in the management of patients with cancer and concurrent cardiomyopathy or heart failure, known as the HeartSuccess program. This is a collaborative, interdisciplinary, patient-centered approach to improve outcomes in patients with cancer and heart failure. I will discuss how the HeartSuccess program was developed, the goals and tools used for program implementation. This presentation will also address the process used to facilitate the patient's transition from hospital to home and a summary of the MD Anderson practice. So, why manage heart failure in patients with cancer? As we all know, several chemotherapeutic agents are known to cause cardiotoxicity, leading to heart failure. The presence of heart failure or cardiomyopathy can affect the oncologist's choice of cancer therapy. The severity of heart failure can directly affect the care, prognosis, clinical outcomes, and patients' quality of life. These patients have complex clinical issues that require an interdisciplinary team of experts to achieve possible outcome. How common is heart failure as a comorbidity in patients with cancer? We reviewed the data of patients discharged from MD Anderson for fiscal year 2012 and 2013. Of the 26,000 to 27,000 hospital discharges, approximately 3.6 to 3.9% have a concurrent diagnosis of cardiomyopathy or heart failure. What is interesting is the 30-day hospital readmission ranges from 36 to 40%, which is much higher than the 30-day hospital readmission rate of 19.6% for Medicare beneficiaries in the general population. What is the most common cancer diagnosis of patients with heart failure? This is our data from the MD Anderson Cancer Center. This slide shows the cancer diagnosis of patients with a heart failure incidence of 4% or greater. Patients with other forms of cancer with a heart failure incidence of less than 4% are not included in this slide. Based on the background information we have available, we decided to develop a heart failure program to improve the coordination of care for patients with cancer and concurrent heart failure. This is the theoretical framework of the HeartSuccess program, a collaborative, interdisciplinary program designed to provide optimum care to patients with cancer and heart failure across the continuum of care, which is from the diagnosis of heart failure during admission to the emergency center or while receiving chemotherapy in the inpatient units, to clinic follow-up in the outpatient setting, and discharge to home or hospice. The tools used for each phase of the continuum are listed corresponding to the phase when they are used. This program was originally known as the Heart Failure Program. However, in one of the patient support group meetings, a patient's wife suggested that we change the word heart failure because it makes her husband depressed, given that he already has a cancer diagnosis. Hence, to put a positive spin, we changed the word heart failure to heart success. Since then, the program is known as the Heart Success Program. The goals of the Heart Success Program are to develop patient-centered care with active involvement of patients in the management of their illness, to improve symptom monitoring and management after hospital discharge, to implement evidence-based pharmacologic therapy for heart failure based on clinical guidelines, and to increase compliance with the Center for Medicare and Medicaid Services, or CMS, core measures for heart failure. The Heart Success team is composed of members from different disciplines. Teams are considered to be an integral component of healthcare delivery and a way to maximize patient care effectiveness and efficiency. I will discuss briefly the role of each team member play in the Heart Success program. The patient and family is in the center of the theoretical model. They are an integral member of the team and are encouraged to be active participants in their care. The oncologists are the primary healthcare provider in the cancer center. During cancer treatment, when patients develop cardiomyopathy or heart failure, cardiology service is consulted. The cardiologists and oncologists discuss the plan of care appropriate for each patient. The nurses are the clinical unit champions who coordinate the care. More specifically, the clinical nurse leaders, or CNLs, are mainly responsible for the lateral integration of care to achieve patient quality outcomes and maintain patient safety at the microsystem level. The CNL is a master's degree level nurse who develops strong partnerships and facilitates connected continuous care with the interdisciplinary team. The pharmacists are involved with patient teaching regarding medications and evaluates drug-to-drug interaction, especially in these patients with multiple comorbidities and who are most often on polypharmacy. The nutritionists meet with patients to discuss nutritional issues. In this patient population, nutrition is a critical issue because of the adverse effects of cancer therapy, which can affect patients' nutritional status. Rehabilitation services take care of the physical and occupational therapy needs of patients. They assist patients with ambulation and develop exercise regimen, which is implemented while patients are in the hospital and are continued after hospital discharge. The case managers are involved from the time of admission to identify potential issues that can affect patients' hospital discharge. Social workers assist with patients who have financial issues, as well as participate in planning for discharge. The tools used for the implementation of the Heart Success program include educational and clinical components. The educational component includes the education of nurses and the interdisciplinary staff. Many of the clinicians are uncomfortable with the management of cardiac issues, given that this is a cancer center and they're specialized in oncology. Prior to the Heart Success program implementation, we conducted educational in-services on the management of the cardiac complication of cancer therapy. Nurses on the telemetry units, where a majority of these patients are admitted, are required to attend a one-day conference with continuing education credit. Nursing administration support was critical in the education of nurses. For the clinical component, the clinicians activate the acute heart failure order set that includes the recommended diagnostic tests as well as recommended heart failure medications based on clinical guidelines. Based on clinical experience, FDA-approved medications for heart failure recommended in the clinical guidelines are also effective in patients with chemotherapy-induced cardiomyopathy. Clinical in-services are conducted where the patient's plan of care is discussed with the team and documented in the interdisciplinary plan of care and teaching record known as the IPOCTR. To reinforce staff education, we conduct case study presentations during weekly case conferences. The nurses present interesting patient cases and discuss the management with the interdisciplinary team. To reinforce staff education, we conduct case study presentations during weekly rounds. The nurses present interdisciplinary cases and discuss the management. The curriculum used for the education of the HeartSuccess team is based on this reference textbook, Cardiac Complications of Cancer Therapy, published in 2013 by the Oncology Nursing Society. This book was developed to provide complete, yet concise and easily accessible information on the most common cardiac complications of cancer therapy, including cardiomyopathy and heart failure. These are the patient education materials used in the HeartSuccess program. These were developed at MD Anderson specifically for this patient population. All patients at MD Anderson who are diagnosed with cardiomyopathy or heart failure while receiving treatment for cancer are encouraged to view the HeartSuccess videotape. This 15-minute video can be viewed on demand by patients and family while in the hospital. Patients are also provided with a copy of the patient education booklet, HeartSuccess, a resource guide for individuals living with cancer and heart failure. The contents of the patient education booklet address the specific needs of this patient population. For example, a list of anti-neoplastic agents with potential cardiotoxicity is listed in the booklet for patient reference. Advanced care planning is also discussed with patients and family. Similar to heart failure patients in the general population, patients are taught to read the food labels, to help them pick the foods lower in sodium, and to pay attention to the serving size listed in the label. To reinforce patient education, we use the teach-back method. Research shows that patients remember and understand less than half of what clinicians explain to them. So teach-back is asking patients, in a gentle manner, to repeat in their own words what they need to know or do. This is not a test of the patient, but of how well you explained a concept. This is also a chance to check for understanding and, if necessary, reteach the information. For example, in teaching patients regarding their medications, instead of asking a yes or no question, ask the patient, "What will you tell your wife about the changes we made to your blood pressure medicines today?" Or, "I want to be sure I explained everything clearly. Can you please explain it back to me so I can be sure I did?" To prepare patients for discharge to home, the key components of the discharge instructions are again reinforced using the mnemonic SMART as a guide, which stands for symptoms, medications, activity, regular weight monitoring, and toss the salt shaker. Prior to discharge, we also make sure patients are scheduled for follow-up clinic visits with their primary care physician or the cardiologist within 7 days of discharge. These discharge instructions are also reviewed with patients during their clinic visit. This is the MD Anderson practice for the management of patients with cancer and concurrent heart failure. Patients with a confirmed diagnosis of heart failure while in the hospital are enrolled in the HeartSuccess program. Enrollment in the HeartSuccess program means there are actions that needs to be initiated by the clinicians as well as the patient and the family. The clinicians, who are usually physicians or mid-level providers, involved in the management of the patient activates the heart failure inpatient order set. The clinical nurses and the clinical nurse leaders initiate the process. The plan of care is discussed during interdisciplinary rounds using the IPOCTR to make sure that all the necessary components of the care are implemented in the management of the patient. On the other hand, the nurses make sure that the patient and the family members view the HeartSuccess videotape. This can be viewed on demand and at any time of their convenience while in the inpatient setting. In addition, the patients receive a copy of the HeartSuccess booklet to reinforce the teaching of the key components emphasized in the videotape. After patients have reviewed the HeartSuccess videotape, the nurses evaluate the patient's understanding of the key points for the management of their disease using the teach-back method. To improve quality of care, nurses collect data related to compliance with the Center for Medicare and Medicaid Services core measures for heart failure. Based on the findings, continuous quality improvement process is applied on the identified areas of care that needs improvement. Prior to hospital discharge, the nurses review the SMART discharge instructions with the patient and the family. A tear-off sheet is also provided that patients can place in their refrigerator at home as a reminder. Patients are also scheduled for clinic follow-up visit with cardiology or their primary care physician within 7 days after hospital discharge. On return to the clinic visit, the SMART discharge instructions are again reviewed with the patient. Patient education is critical to make sure that patients do not develop worsening of symptoms that may require emergent hospital admission. In summary, patients with cancer and heart failure present with complex problems that require an integrated interdisciplinary approach to improve clinical and cost outcomes. Close collaboration among healthcare providers is essential in the management of the cardiac complications of cancer therapy and requires an organized program across the continuum of care. Improving the quality of care involves choosing effective strategies or quality measures, ensuring adequate implementation, and engaging in ongoing evaluation. Thank you.